Well, building community together is, as its name suggests, about building community. It's a way of working with the people who live in the district in order to find out what they most need and in order to make best use of the skills and the attributes and the strengths that they have to offer to meet those needs. So we're committed as a council to helping people to help each other and helping people to help themselves, and that means finding out what they're good at, finding out what they do well, inviting them to come together and solve local problems with their local solutions. If you think about it, the people who live in a particular community will have different strengths, different skills, different things that they're interested in, and at the same time their neighbours and their friends will have different problems, different issues, different things that they'd like to see change. When you bring those people together, it's absolutely powerful conversation to have, because what you find is that the solutions to those problems are in the community and the community can discover that for themselves. So for me, this way of working is something that has been both a personal journey as well as a professional journey. I realised there was a language around the way that I like to work, which is called restorative practice. It's about doing things with people rather than doing them for people or doing them to people. We brought that way of working into some work that I did in the past in other local authorities on a much smaller scale, and when I came here to West Berkshire I had the most fantastic opportunity to take those same principles and apply them across a whole directorate. That's working with adults, working with children, working in education, working across housing. What a fantastic opportunity to bring those principles into the district. So one of the things that's really important about this way of working is that you have a whole different kind of conversation with an individual, with a family, with a community. You start in that conversation by looking at what strengths they've got, what it is that they want to contribute, the outcome that is most interesting and exciting to them. And because you start from where they are rather than where you are, it transforms the kind of conversation that you have. It transforms the possible future for that person, for that family, or for that community. And it's what makes it exciting to work together and to community build in this way. There's a really good body of research dating back more than 20 years which shows that one of the main factors in a successful piece of work with any child or family or adult is the quality of the relationship between the person doing that work and the person on the receiving end. And what that means is that we pay really strong attention to relationships in the work that we do. That's made us have 4 commitments which underpin all of our activity in this area. We say that we'll work with people, we won't do things to them, we won't do things for them. We say that we'll see people as a collection of their strengths, their qualities, their assets. We won't regard them as a collection of problems or issues to be solved. We say that we're going to be more interested in their lives than in our services. That's really vitally important. And we don't want to be saying no to people, so we're looking hard for ways to say yes differently. We've got really good evidence that it works here in West Berkshire. One of the things that we've done is we've built our new ways of working in adult social care around these principles. What we've seen is that it's increased service user satisfaction, it's increased staff satisfaction, and it's also saved us money, which can't be bad. We've implemented a new emotional health academy, again using these principles for development. That meant that we involved young people in the development of the academy. It meant that we focused really strongly on providing speedy access to support for those young people without them having to go on a waiting list for a clinical intervention, and that has made a significant difference to those young people in terms of receiving support. It's changed the way that we've worked with our troubled families. Our turnaround programme is again built on these principles. That means we focus very strongly on what those individuals need, and we work with them in order to find a passage for them back into work. And we've had one of the most high success rates in the country in relation to our Turnaround Families programme, which has been brilliant. We've also started whole system work in our schools using our Healthy Schools Coordinator, and so we're introducing restorative practice into some of our schools and encouraging and enabling the students to take control of those kind of conversations, which will tackle things like bullying, raise self-esteem. So that's really important again in relation to young people's well-being. And finally, we're starting community conversations in 6 areas in the district, which again is encouraging local communities to decide what matters for them, identify their own priorities, and focus on the ways that they can locally tackle those priorities with our support. So sometimes people ask me how they could get started, and it's really very simple, because you do it your way in your own location. So you start from where you are, you work with what you've got, and you do what you can.